On one of Renee's routine visits with Dr. Patrick Abergel, they devise a plan for her next stage of improvements.
Hello, good morning. So what brought you in today?
Well, how much time do you have? The most important aspect for me to correct is the under eyes.
Very well. So why don't we look at this first?
Okay.
Yeah, you see what's happening under your eyes is that you've started developing those bags. That gives the tired look. So that's our priority. Let's get rid of it. Okay? Now, you wanted something totally non-invasive.
I do.
Okay. I have it for you.
Okay.
Okay?
Good.
It's the laser eyelid surgery. This is a wonderful procedure. It's remarkably safe. It's remarkably effective. And most importantly, you get absolutely no cut. There is no suture. And you can go back to work within 3 days.
Really?
How would you like that? Simple.
Sign me up. That's what I want.
The other thing that I would like with your eyes, and I'd like to elevate just a little bit your eyebrow.
Renee is also interested in Restylane, a new injectable gel used Renee's eyebrow lift, lower eyelid surgery, and Restylane injections to fill in lines around her mouth and lips. Minutes before Renee's surgery,
This is the one that I'm about to do. The correction and the augmentation for Renee's lips will be much more significant than we usually do. But it's just the reason is that she really wanted larger, fuller lips. So this is a little shield to protect the eyes.
Next, Dr. Abergel uses a CO2 laser to create a fine incision in the lower eyelid.
The reason for using the CO2 laser is that it stops the bleeding. So as you cut the tissue, it cauterizes. So there is usually a lot less bleeding, therefore a lot less bruising for the patient, a faster recovery, usually no pain afterwards. You see the fat bulging? And this is the fat that creates the puffiness under the eyes and the tired look.
He cuts out the excess fat.
You see, it's pretty significant what she has.
With the eyes complete, Dr. Abergel punctures a small hole in the skin above Renee's eyebrow to gain access to the muscle.
This is a totally blunt instrument. You see, it's flat, like a spatula.
This muscle normally holds the eyebrow down around the eye. By severing it, Dr. Abergel is able to create a subtle lift.
Very natural. Doesn't even need a stitch.
Last up, Botox injections into Renee's forehead. Botox paralyzes the connection between the nerves and the muscles, so the muscles can no longer contract and the wrinkles disappear. The total time for this operation is a mere 45 minutes.
So you see, this is what patients want now. They do not like long procedure. They do not want invasive surgery. So this is, as you see, minimally invasive. It's going to give a nice result, very natural. And most importantly, they'll be able to return to work within 2 days.
Coming up, find out if Renee's quick fix gives long-lasting results. 46-year-old Renee Levine wants to hold on to her youth, but hopes to avoid the knife as long as possible.
It's like I woke up one day at 46 years old and like my face kind of wasn't there anymore.
6 weeks ago, she underwent 4 age-defying procedures without a single suture to the skin. Today, she's showing off her seamless results.
As soon as I got home from the surgery, I saw myself for the first time. I was amazed. I felt like I could have gone out right at that moment. Hi, guys.
Hey. Hi. Sorry I'm late. Hi.
Hi.
You want to see?
Yeah. Wow. When you walked up, I didn't know what to say at first because it was just so striking, but especially the lips. I can't help but stare at them now, you know.
I just love the result, especially when I look in the mirror. I can see it's like a three-tiered process, the lifting of the eyebrow, the great eyelids, and this is just so smooth now. And it's just wonderful.
So what do you think?
I think the lips are great.
Yeah.
And the eyes are fabulous. You're just like so bright.
That's right.
I wonder what else they're going to invent. I'm so excited.
I love my lips. Finally, I got with the Restylane what I've been searching for. When he said back to work in 4 days, it really was back to work in 4 days. I was back to work on Monday.
Here's a toast to your new looks.
Thank you.
Would I have anything done again? Oh, absolutely. When it's time, sure. Will I get Botox? Sure. Will I get Restylane? Sure. I will be dating a lot. It's almost like I have this new face, so I want to put my new face out there. I have a guys do pick up on that.